Hi everybody. I'm going to show you in this video an MFM movement because it is not just about yoga. It's not just about doing martial arts in your clinic. It's about taking the best principles of yoga and martial arts and plyometrics and modifying it into the clinical setting where patients can actually do it and start reaping the benefits of these great movements. But too many practitioners and clinics are not doing that. And a lot of the benefit goes beyond just the physical. It actually goes into the emotional, psychological, nervous system, kinesthetics, proprioception, and even a higher level still, but I'm not going to get into that. We're going to start with core issues, whether it be due to spondylolisthesis, degenerative disc disease. So Amanda's here with me. Bring Freddie over because I want to go ahead and kind of explain real quickly, just kind of set up the basis for this movement I'm going to show. I'm going to show you a phenomenal movement. You probably have never seen it. Those of you who have, you may have seen it, but you probably aren't doing it with your patients. And so I'm going to show you a really cool modification so that the patient can still do it safely, effectively, and reap the benefits of it. But it's not going to be the way that you typically see just, you know, any person on the street do it in a yoga class or in a martial arts class. So now this is Freddie here. Now, so what I want to do is show you a movement that works for anyone who has core issues here. Now, what I mean by that is the most common core issue is anterior pelvic tilt. You guys know that, which means tight lower extensors here, tight anterior hip muscles, lengthened weakness of the hamstrings, and lengthened weakness of the abdominal muscles. Now, they probably have degenerative disc disease because you can't be in that position for that long without developing it. And if it's even progressed a little bit more, then they probably have spondylolisthesis because they probably have a lot of compression of the facet joints. As you know, a hyperlordosis, you get a lot of compression of the facet joints. And they probably have a lot of hypertrophy, and they might actually even have spondylolisthesis. And a lot of times spondylolisthesis goes undiagnosed unless they actually start getting symptoms and go in and get an x-ray, et cetera, et cetera. And a lot of DDD, degenerative disc disease, gets undiagnosed as well because they don't become symptomatic right away, but when it's too late. So let me go ahead and show you a movement, but before I do, I want you to know that what I used to do when I was a beginner therapist, I used to actually do exercises for the hamstrings, you know, because that lengthened weakness, want to tighten it up and strengthen it up, right? So I might have them doing like a Swiss ball leg curl, things like that, or prone, you know, leg curls. I would also stretch the psoas, and you guys know, you know, typically just kind of get into like a half kneel and squeeze the buttock and stretch it like that. And then I would also do some abdominals, right? Some pelvic tilting and some lower abs and just some abdominal things. And then I would try to stretch the lower extensors. Now that's what I would do. I would probably add some other stretches and strengthening and things like that. But really, when I was a beginner, just a lot of that kind of uniplane, more isolated stuff. So I would have a list of like 10 to 12 things. Don't want to do that anymore. Why? Not only it takes up a lot of time, patients can't remember all the exercises, and quite frankly, it's inefficient. And you know, with the lowering reimbursement and consumers wanting to get better faster because they hate those copays and deductibles, we like to make it simple but super effective so that they actually in their mind say, "Wow." Okay, so let's go ahead and do the movement. So that you don't have to do a bunch of stuff. Let's go and do a movement. Amanda's here with me. Thank you, Amanda. Can you put this away? I'm going to have Amanda show you a movement. I'm going to explain to you as she's doing it. I'm going to explain to you exactly what's going on and why it works. Perfect. Thank you. All right. So I'm going to get down here on the floor. Now, don't worry if your patient can't get on the floor, which that might be something you might want to get them to do first. But if they can, I'm going to show you a modified version of this so you can start applying it right away. So Amanda, go and show me the dragon pose. Now this is your traditional, typical yoga pose. I love it. It's super, because I love the word dragon. I love dragons. But so let's go and show you the standard yoga pose. Go ahead. Now I like how she's got the half kneel. She's got her heel under her knee. already we're getting some stretching of the proximal hamstring. Now, I'm going to explain to you in these technical mechanical terms, but no, this is a yoga pose. It has more deeper, profound benefits. That's one of the reasons why I want to show you how to integrate it, is because these aren't standard linear types of stretching and strengthening. Okay, so, but I like what's going on here. Now go ahead and put your hands down. Now this is the dragon pose. This is the beginning of the dragon pose, but as you can see, what's happening here, as she also extends her leg, is we're starting to get lengthening of the psoas. We're also starting to get lengthening of the lower extensors. But this isn't just a one-sided activity. This is a dynamic reciprocal activity. On the other side, now go ahead and go down fully into the pose. So, because this is the actual dragon pose here, where you're actually on your elbows. Amanda, is this challenging? Mm-hmm. Okay, this is challenging for a fit, what are you, like 22 years old or something? For a fit, athletic girl. But I want to show you what's happening on the other side as well, because we're already accomplishing something here, and we're also even accomplishing, this takes effort. This takes effort of the entire body, and it's doing things to the nervous system that is beyond sometimes our own understanding. I'm not going to get too much into that. Okay, now go and switch to the other side. Now, as you notice, we have a bolster here just to make the knee a little bit more comfortable. So even if a patient can get on the floor, make it more comfortable for them. Now try the other side so that we can see what's going on. Now, this what was happening on the other side. Go ahead and get onto your hands. Now, what's happening here, which is super, is we're starting to get that proximal hamstring. Now, what you want to externally rotate, so you do that by rolling onto the outside of the foot here, outside of the foot. Now, we're actually getting some torsional stretching of the pelvis. And even though I'm saying stretching, you guys, this is not what we're trying to achieve. It's just a mere stretch. We're actually getting also lengthening of the proximal hamstring. We're also getting the nervous system challenged and starting to actually normalize that as well. And once we can do that, you'll start to see some great things happen. And there's a kinesthetic and proprioceptive component to this, which all yoga poses have, by the way. So we're also, now go and get onto your elbows and stay on the outside of your foot, getting that external rotation. Push against here a little bit. And now we're starting to see some really great things happen. We're starting to see the lengthening of the lower extensors. We're also getting lengthening of the proximal hamstrings. And more than that, you want to hold this position for 12 breaths. Now, I like to go up to 20 breaths with some patients, but they can start out with 12. And I like to go by breaths, not seconds. But she is being challenged right now. Okay, let's go ahead. How are you feeling, Amanda?
Good. A little challenged.
Okay, come on up. Now, if a 22-year-old athletic girl is challenged, you're going to need a modification probably for most of your patients. So let's go and show you a modification. Come on up. All you need is a little stool like this. Everyone has it, especially patients. If they don't, they can get it for like $5. So get a little stool like that. And here's the modification. They're going to put the foot up there. They're not going to actually get on the ground. They're going to put the foot up here. Go ahead. And then they're going to go ahead and put their hands. Now they can do this at a table, but make sure the table is sturdy. They can do it on maybe the back of a couch as well. But go ahead and get onto your elbows. Now as she does this, we're getting the benefits of the yoga pose. We're just modifying it a little bit, and we're still getting the rounding, the lengthening of the lower extensors here. This is actually, you want to try to get into a tabletop position like this. And we're also getting challenging of the psoas muscles here. And we're getting a lot of gluteal lengthening here. But this is all a dynamic reciprocal movement that actually heals, that actually starts to work the proprioceptive system, the kinesthetic system, and like I said, it works the nervous system in a way that gets patients more excited. It actually is connected to their emotions and their self-esteem, helps them to feel younger, helps them to feel less stressed. And once again, it's for 12 breaths. Go ahead and stand up and do the other side so they can see that real quickly. So here's what it looks like on the other side. Foot's up on a stool. Come on down and onto your elbows. And you can start seeing the lengthening of the lower back extensors, lengthening of the proximal hamstrings, but you're also getting a torsion of the pelvis. It's still comfortable, but is it still challenging for you at all?
It is.
Okay, a little bit. So it's something that the patient can easily control and easily monitor, not pushing into the primary pain, but you start getting the benefits of the great benefits of yoga, which go beyond just the physical and just the mechanical muscular components. So this is MFM. We're going to show you protocols, modifications. We're going to show you everything that you need to carry over and integrate these super amazing movements so that you can start taking advantage of the movement-based treatment methods that can really transform you into a modern-day therapist and really start getting more younger populations seeking your services, athletes seeking your services, but also start getting more cash, more payment plans, more HSA accounts, really start growing your revenue as well. Thank you, Amanda. Everybody.
Bye. See you at
Bye.
MFM.
See you at the MFM certification class. Bye.